to come prepared to ask questions and for it to be a interactive discussion, but orderly discussion. Give me an opportunity, please, because we're new. This is the first time that we're coming to you to introduce our members. I'll give you their names, and I'm sure as time goes on during the year, you will have an opportunity to meet each of the persons if you don't know all of us already. So Dr. Terrell Carey is our very able vice president. We have Dr. Nikkiah Hall Dennis, who will act as our secretary. We have Dr. Rodina Ferguson, who will act as our treasurer. Trustees include Drs. Latoya Monroe and Dr. Patricia Duncombe. And of course, Dr. Marcus Cooper remains with us as the immediate past president. Again, welcome to each of you. I'm going to turn the podium, so to speak, over to Dr. Terrell Carey, who will be the moderator for tonight's events. Thank you.
Okay, thank you, Dr. Dorsett, for that very warm introduction. I'd like to, again, introduce our speaker for tonight. Well, she's basically our expert for tonight to help us to gain some knowledge on the COVID-19 vaccination. As we all know, this is a very topical issue at this time. A lot of patients are handing us questions daily about whether or not we should recommend the COVID vaccine. What is the evidence, and is it safe? And Dr. Nikkiah Forbes, who has graciously offered to assist us this evening with the discussion so that we can all become a little bit more knowledgeable about the vaccine. As you may know, the government of the Bahamas has signed up for the initial deployment or delivery of the COVID vaccine, which we expect to receive by the end of the first quarter in 2021. And we're trying to gain some knowledge on it. And we're hopeful that we can have a lively discussion, that we can get some questions answered, as Dr. Cindy Dorsett mentioned, in an orderly fashion. We have a lot of persons attending the meeting, and we had a lot of persons who submitted questions prior to the meeting. So it may not be that we get to answer all the questions, but Dr. Forbes is very approachable, and I'm sure that any other questions that are left unanswered, you can, and we'll leave the email address in the chat group so that we can answer those questions soon. And just of note, Dr. Forbes did a very excellent presentation on the COVID-19 vaccine last week, Thursday, in the University of the West Indies Symposium in the aftermath of COVID-19. And I put a link in the chat group so that anyone who wants to gain some knowledge, it's about an hour or so, you can reference that link at any time at your convenience. So without further ado, our local expert, she comes as no stranger. She is the director of the National HIV and AIDS Program, Princess Margaret Hospital and Doctors Hospital. And also the West Indies Clinical Medicine and Research. And on the raise hand option, and we will try to answer the questions in a orderly fashion, first come, first serve, and we'll try to limit the questions to 1 to 2 questions max. And I will lead the questions by basically chiming in from one of the questions that were sent to the Medical Association. We will start with, the first question would be, how long does the immunity last after receiving the vaccine? And I guess you could chime in based on your knowledge of the various vaccines that are available.
So good afternoon, everyone. Thank you for inviting me tonight to talk about the COVID vaccine. As Dr. Carey said, we talked about it at length just under a week ago, but there were a lot of questions that people still had. So to get right into that question, so our understanding of immunity from COVID, even after natural infection, depends. It is really based on our understanding of what happened with other coronaviruses, like the first SARS and MERS. And in those infections, people could have immunity that could last up to 2 years. But in some cases, people's immunity started to decline after some months, 3 to 6 months. And then what about our experience with COVID-19? And so, as you know, we've been knowing about COVID-19 for just over a year. And we know that there are uncommon cases where people with COVID-19 can in fact get reinfected. And in some cases, this can happen as quickly as 3 months afterward. And we're still looking to see what is associated with that. So that's the background when you think about immunity from SARS-CoV-2. That's the virus that causes COVID-19. But this is different in vaccines than it is when you get natural infection. And so it could last for years, but scientists are considering that we may need a booster for COVID-19 vaccines or SARS-CoV-2 vaccines. This is even more compounded by the fact that there are variants and mutant strains that are developing. It's not unusual for a virus to mutate. And the more COVID we have in the world, the more likely that is to happen. And so vaccines may need to be tweaked a little bit for these newer strains, and all of that remains to be seen. So it's not clear at this time if and when we'll need a booster for these COVID-19 vaccines. Nobody knows the answer to that yet.
Okay, thank you. Can everyone have the ability to raise their hands as I'm doing? If anyone is interested in asking a question, you can just click on the reactions tab and you can raise your hand and we will unmute your microphone and allow you to ask Dr. Forbes any relevant questions that you may have. While we wait for persons to raise their hands so that we can ask questions, I will continue with the second question that was submitted to the association. From what age is the vaccine given? Why is it not right for children not to have children dosed vaccines? And what are the side effects of these vaccines as far as you know?
So the answer to why vaccines are not approved for use in children yet is because we make indications for medications and vaccines based upon clinical trials. And in the clinical trials, for example, the Pfizer vaccine, the age group was 16 years and older. And in the Moderna vaccine, the age group was 18 years and older. And so at this time, there's no evidence. There's no hard scientific evidence, which is the way we like to practice in terms of what would be the efficacy in children, because it wasn't a studied population. Now, that being said, it's probably going to be helpful in children, but there needs to be trials now involving children. And until we see that in that data, there can't exist any guidelines for use or recommendations for use in children. But that's exactly why it's not used. They are going to involve children if that's not already happening, so that we will then be able to have recommendations for use in children as it relates to the side effects of the vaccine. So for those vaccines that are receiving emergency use authorization, that's the Pfizer vaccine, the Moderna vaccine, the Oxford AstraZeneca vaccine, most of these side effects were mild to moderate. So like most things, many people did not have any adverse effects or many adverse effects at all. But for those that had adverse effects, they were mild to moderate. Okay. And that could include, are you hearing me okay? I hope my internet is not acting up.
No,
that could include,
for 1 second, I can hear you now.
A sore arm, muscle aches, fever, dizziness, headache, fatigue and lethargy, chills, for example. And so most of these side effects were very transient. They lasted about 48 to 72 hours, and they were generally not considered severe. Now, it was mandatory, like in all clinical trials, that adverse effects were reported and safety wasn't, there was no cut corners with safety. Now, that was the Moderna, I think that was the Moderna trial. There were 2 neurological events. One patient had multiple sclerosis that was undiagnosed, it seems, before the trial. And the other person had transverse myelitis that they were looking into to see if it was the vaccine. If they don't know, it could be for or against, out of quite a number of volunteers. Then there's something else that we need to consider, which is that some persons had allergic reactions. And I think it's actually 1 or so persons per million. And how do you know? I saw this when Dr. Carey sent me the list of questions. How do you know you will have an allergy? So most of the persons that developed an allergy had a history of allergies to medication or food, and they either had hives or swelling of the lips and tongue or that kind of thing. And so there is a CDC recommendation that if you've got a history of allergies, that you should use caution and perhaps consider not taking the vaccines at this time. So those are what we know so far of that. Effects, and to actually have gotten to the point where they are having FDA emergency use authorization, which is the body that does this, and that's the exploratory phase, the preclinical phase, phase 1, 2, 3, where safety is looked at. And when they have emergency use authorization, which means the FDA says that they're more of a benefit than a risk, they have to continue to gather safety data.
Tracy Halkitis, we're going to unmute your microphone and allow you to.
Good night, everyone. Can you hear me?
Hi, Tracy. Yes, hearing you well.
Hi. Good night. Good night. My question is, do we know which vaccine the Bahamas has been slated to receive?
That's not clear yet, and it's probably going to be based on COVAX. So COVAX is a mnemonic that the WHO is using for the accessibility of COVID vaccines. Now, it's probably going to be based on they have a platform for medications and other therapeutic modalities, including vaccines, and how it's distributed. And it could be variable, but more than likely it's going to end up being either the Pfizer, Moderna, or AstraZeneca that the WHO has in their COVAX plan.
Okay, thank you.
But I'm not certain. Maybe the WHO rep, they have a meeting every week where they speak to the press. I think that will get clearer.
Okay,
thank you,
Dr. Halkitis, for that question. Just if anyone is unable to question directly into the chat, and I will read the question to Dr. Forbes. I see Dr. Geary has sent a question. When is the vaccination going to start in the Bahamas? Is there any tentative time or date? What vaccine are we getting, which you mentioned already?
So we've heard Minister of Health say that it's being planned for the first quarter of 2021. And the WHO representative here has said that it can happen as early as March for the Caribbean. But these things come at a cost. So which I didn't really touch on in too much detail in last week's presentation. But when we look at this whole COVAX platform, it's really important because it looks at accessibility and equity and fairness. So you know that a lot of these vaccines and the developers of the vaccines got funds, and there is a financial cost to these vaccines. And so the COVAX platform is really important to advocate for, having accessibility to vaccines and commodities like that. So if you turn on your TV, you'll hear things like 2 million doses being promised for resource countries, and we know the whole world needs it. There's more than 100 million people who've had lab confirmed COVID to date, and so it's really important when for things like COVAX to happen, so that developing countries can get this, and it is being prioritized for the region through the WHO COVAX. So we'll have a better idea when we see what's available through their modalities.
Okay, thank you again, Dr. Forbes. Just to remind everyone, you can raise your hands. You can click the reaction tab at the bottom of your screen, raise your hand, and we will unmute you and allow you to ask Dr. Forbes your questions. There's about 172 persons in this meeting, and I'm sure the questions are burning. So please feel free to raise your hand, or you can type the question into the chat box. Just another question that was sent to our MAB office. With today's technology, it is much easier to make vaccines than to predict the potential adverse effects. Would it not be
We have to see what's at stake, right? So today, I just quickly like to look before we come into a meeting. More than 1 million people with COVID-19, that's lab confirmed. That's an underestimate. There's more people than that who's had COVID or SARS-CoV-2. And when 2 million people have died, and this is not going away, you can see that there are that are undergoing lockdowns again, and cases are surging some places. I'm only so happy that we're not in that situation right now in the Bahamas. Now, that being said, how do you get it? You breathe in and you've been exposed in the wrong scenario. And yes, we know that there's social, it's very bad. And so huge global emergency, and so quickly, because when you just hear about it and say, okay, well, we only learned about COVID just over a year ago, how could we have a vaccine? It gives the impression some corner cut doesn't